I feel real good. I feel very much stronger now. I'm no longer in the wheelchair. I can't run yet, but I'm walking. Say hi to the folks for me, from the physio to the cleaner, the whole lot. They do not know how much their visits meant to me. And those nurses, man, wow, they were good. I wasn't doing too good in the hospital, but I had a good time. And the main thing is it has a lot to do with the care and attention. I was so impressed by the treatment I received from the hospital. Since I came out, I really realized what I went through. I really appreciate the care and concern that folks had, and it helped with my healing.
We always talk to our patients even though they're asleep. We're not always sure if they hear us or not, but you talk to them when you do something, you tell them how the day goes, you tell them that the family has called and give messages back to the family. We tell them what the plans are to help them get better. Even though they might not know our names and faces, we know them and we chat with the other nurses because we want to know how they're doing. It's nice when they're awake because actually you can see in their eyes that they can hear you and they can understand what you say to them. But you build this relationship even when they're asleep because it gives you a feeling that you deal with a human being. Every time we see somebody who is getting better, it reminds us why we're doing this job.
It's gonna be alright. I feel it in my heart. Yeah, yeah. It's gonna be.
There was a patient who was in ITU that was there for 2 months on maximum support because of the virus. And I went to see him on HDU and he was doing great. We managed to take the tracheostomy off. He's doing really well and he's going to be stepped down to the ward. So it's from ITU to HDU to ward, and seeing that is amazing. I would like to tell my colleagues, including myself, just remind yourself that there have been a lot of patients that have done so well recovering from COVID. To see patients recovering is definitely motivating.
The pressure on our adult intensive care system was growing around London and the UK. And our colleagues here working in the adult critical care areas were getting more and more demand for them to make more beds and help within this new surge as much as possible. During this wave, we have recreated an adult intensive care unit within our paediatric intensive care space, and we have relocated a number of our paediatric intensive care beds through to our normal children's ward. The speed at which the number of patients that came into ITU rocketed was just enormous. There is no doubt in anybody's mind, anywhere, if you speak to any of the intensive care units, that this has been far more of a challenge. We're seeing young adults with no pre-existing conditions who are becoming really critically unwell, requiring ECMO and requiring ECMO support. We're seeing young pregnant women requiring ECMO and ECMO support. The work is heavy and hard. You're wearing PPE head to toe. It's incredibly hot. And then there's the emotional toll. You are working often in environments that you don't know, with people you don't know, caring for patients that are incredibly sick. You're mindful that this is somebody's loved one and that their family members are not there with them because they cannot be at this time. So not only are you out of your comfort zone, but you're mindful of wanting to provide the best care you can for somebody's loved one, and that's really hard.
In a very short period of time, we needed to learn so much. We are used to deal with patients who have always family around them. So I think that the emotional part was very, very hard. Of course, you just need to go along and see beyond that what you can do from the medical and nursing point of view. And I think that that brings very warm feeling, knowing that all of us, we were working as a single team.
If at first you don't succeed, try again.
When I was asked to come back to volunteer, I just felt I was just coming back home to my family. It was just so lovely. And people have been so kind and so generous. I stand beside them every day, help them put on the PPE. I know how heavy it is. I can see them, they're sweating. Initially it was very daunting watching your colleagues putting on all this PPE. It was like futuristic. It didn't feel like you were working in a hospital. When they come out after doffing, you see the little marks on the noses from the PPE they're wearing, and some have little cuts. And they just brush it off, or stick a bandage on and off they go again. And they just don't make a big deal out of anything. They just get on with it. Very brave. It was just lovely to see how closely they worked together, and morale was very, very high. Obviously for the second time round, they are very tired, exhausted, but again, same sort of atmosphere. It's amazing how they do it. They really are fabulous.
The response to the second surge has required every member of staff, no matter what their role has been. So we've had staff redeployed to work in different areas, and it must have been terrifying for them to go and work in an area that's unfamiliar with them or that they haven't worked in for several years, but everyone really stepped up and did what was required. During the surge, it's been important to try and keep the other emergency services going. So we've continued the Heart Attack Centre at Harefield, we've continued our emergency admissions from other hospitals, and we've continued our transplant service through the whole period. And that has been challenging because, of course, we've had to spread our staff over all areas to make sure everywhere is safe, but we've managed to do it. I can't tell you how proud I am of every member of staff. I'm just so impressed with how staff have responded to this surge.
I want to be able to help out as much as I can. I've got clinical skills that are transferable, and I hope that me coming down here, even if it is just one day a week, is actually doing something to help the patients and the rest of the staff in ITU. I think the ITU team are just doing an amazing job, and they've been incredibly supportive. Coming in and doing clinics, seeing patients, gives me that bit of normality, means that we can keep some services going, which is obviously really important. And I think a lot of people have found that really beneficial this time. So several of my team are doing exactly what I'm doing. They're spending a day or 2 days a week down in intensive care, which is then less pressure for them, but enables them to feel that they are helping out.
Where we would very comfortably normally have one nurse to one patient, we were stretching our nurses to look after one nurse to 4 patients, and our medics were being stretched to 2 consultants, essentially managing a whole area, which was challenging, I think, for most people. We've had a very good success rate of discharging our patients following either an ECMO run or mechanically ventilated, and those patients have tended to fare very well. What we saw in this second wave was a higher group of people either heavily pregnant or mothers who just had a baby. And actually the majority of those people have done very well too and have gone on to deliver their babies, which was so wonderful to see. I've been so incredibly impressed and proud of what everybody's achieved, and we need to be really mindful about how we look after staff now. We are exploring with well-being and psychology how we can look after our staff.
There are changes that have happened in the last year that mean that we will never be quite the same again. I think our technology is better and our communication has been absolutely overhauled, and I think there are lessons that we've learned that are really going to stand us in really good stead for the future. We've learned a lot about each other and how we work together, and those lessons are not going to be lost. What I do hope is that we will have a legacy of kindness and understanding for each other. Many people have helped in this time in different ways, and actually respecting those different ways. Not everyone is able to come in and look after adults in a red COVID zone. That doesn't mean that the value is any the less.
It's really important for every member of staff to know that we see them and that we see the job that they're doing and the stresses they're under. We're also really lucky this time in that we've got other support systems in place. So our ward colleagues have also made huge sacrifices, both first time round and now. They're sending us buddies just to help us out with personal care of the patients, moving them, looking after them, and just the smooth running of the unit on a day-to-day basis, and that's a lot to ask of them. We also have other colleagues who work in our nurse specialist roles and in other areas who are coming back to us. So across the board, it's balancing that need and trying to make sure that everybody is being taken care of whilst trying to provide the service that we want to deliver.
Just open up your hand, it's gonna be alright. It's gonna be alright.
Be kind to each other. Maybe not everybody feels like talking, but being nice, being kind can help. Some people like to talk to everybody, some people prefer to talk to specific people. There's mental health and physical health appointments available, so people can go and talk to somebody, be seen if they need to. I would encourage my colleagues who feel like they need to get some help to do so, because it's really hard to deal with all this.
Being able to share your experience with someone that's also going through similar situations, it makes you feel that you're not alone, that you're not the only one that sometimes struggles. You're not the only one that sometimes cries after a 12-hour shift because everything has just been so overwhelming. So being really able to kind of relay on our colleague and having great managerial support is something that's been really quite beneficial. You're not alone in this situation. We're all going through this. We've all taken on new challenges, things that we've never faced before. And I think as a team, we've showed that we've really been able to work in collaboration and work together to provide the best care that we can. And that's the reason why we became nurses, to be able to help people. For us to be able to work together is something that I'm very proud to be part of. Yes, we are going through a tough time, but as long as we continue to work together and continue to fight this fight, at the end we will be able to have our service back.
You can make the world spin however you want. You can move the sky